Good afternoon. Today I'd like to talk about the high cost of prescription drugs in the US. According to a September 2015 New York Times article, Daraprim, a drug vital to HIV patients, was sold to Turing Pharmaceuticals. Turing immediately raised the price of Daraprim from $13 a pill to $750 a pill. Sovaldi, a drug that cures hepatitis C, actually costs $1,000 a pill. How can pharmaceutical companies charge so much for life-saving drugs? It should be illegal, but it isn't. Unlike other developed countries, drug companies in the US can charge whatever they want for drugs. According to an October 2017 USA Today article, the reason drugs cost more in the US than in any other country is that Medicare can't negotiate drug prices with pharmaceutical companies. Have you ever had a prescription suddenly double in price without warning? When drug prices become too high, people stop filling prescriptions, which leads to health complications. This has a devastating effect on healthcare. The public pays for this, either through higher insurance rates or directly out of pocket. The question is, how can we control the price of drugs? In the US, we need regulations that protect consumers from having to spend so much on medication. Let's begin by examining how drug costs spiraled out of control. In 2003, the Medicare Prescription Drug Plan became law, making Medicare unable to negotiate the price of drugs with pharmaceutical companies. This allowed drug companies to basically charge Medicare any price they wanted for drugs, and they could drive the prices up at any time. And this completely drove up insurance rates. In a March 2016 issue of Milbank Quarterly, Catherine DeAngelis states that drug companies claim that the high cost of medication is due to the high costs of research and development. However, R&D of drugs is already paid for by taxpayers through organizations like the National Science Foundation, the National Institute of Mental Health, and universities, not by the pharmaceutical companies themselves. In his 2014 book, Deadly Medicines and Organized Crime, Peter Gotcha states that pharmaceutical companies spend their money on marketing, not on developing drugs. The US is one of the only countries in the world that allows pharmaceutical ads on TV. Drug companies routinely market drugs that are no better than cheaper drugs already on the market, or they market drugs to people that don't actually need them. Pharmaceutical companies also directly advertise to doctors in the form of free samples. Studies have shown that doctors who give out free samples to their patients almost always prescribe the same drug when the prescription runs out, or when the free sample runs out. In addition, the FDA doesn't require companies to provide any information about whether a new drug is clinically better than an older, less expensive drug. In the past, generic drugs were a valuable cost-saving alternative to brand name medications, accounting for 80% of all prescriptions. Generic drugs are supposed to keep drug prices competitive and low, but this has failed to happen. One reason is that generic drug makers have begun to act like the brand name companies that they are supposed to compete with. Mylan, a generic company, bought EpiPen, the auto-injector, and immediately hiked up its price by 500%. In other cases, drug companies use a policy known as pay to delay, where they pay generic companies to actually keep their products out of drugstores. Pharmaceutical companies also withhold proper doses of their branded drugs, so generic companies can't test to see if their products are actually the same. The price of prescription drugs in the US needs to be regulated and controlled, like it is everywhere else in the world. Americans need to come together to demand that Congress pass legislation that allows Medicare to negotiate fair drug prices. Prescription drug ads need to be banned in the US, as they are in every other country, because drug ads misinform patients, promote drugs before they're safe, encourage over-medication, and increase healthcare costs. Conflicts of interest need to be eliminated from politics. Congress should be prohibited from accepting campaign contributions from drug makers, and the government needs to put the health of Americans ahead of drug company profits. It's time to regulate the cost of pharmaceuticals. Government agencies need to fight for fair drug prices. The FDA needs to get generics on the market, and the Federal Trade Commission needs to make drug companies more competitive so that it lowers the cost of medicine. A growing number of physicians no longer accept free samples. For example, Stanford Medical School has prohibited staff members from accepting them. Skyrocketing drug costs are beginning to attract the attention of federal and state legislatures. However, the pharmaceutical industry has enormous power in Washington, with lobbyists fighting to let drug companies practice business as usual. Hopefully, the tide is turning in favor of fair drug prices in America. Today, I have shared with you why prescription drug prices are out of control and ways to fix the problem. I have talked about the importance of supporting and advocating for legislation that will lower the cost of drugs, which will in turn lower healthcare costs in the US. Who wants to live in a world where we're denied life-saving drugs because of their cost? In 1954, Jonas Salk donated his polio vaccine patent because he wanted the world to benefit from it. This high ethical standard is something that pharmaceutical companies could learn from. The reason regulating drug costs in the US is important is that the health of our people shouldn't be determined by the cost of a drug. Thank you for listening.